the next paper is Outcomes of Pediatric Open Globe Injury at a Tertiary Care Hospital by Vanaja, Iyer.
Good afternoon, everyone. I am going to be presenting paper on outcomes of pediatric open globe injury at a tertiary eye care hospital. In the pediatric age group, ocular trauma is a leading cause of non-congenital visual impairment. The predictors would be age,
5 minutes. So just
visual acuity, wound length, location, iris prolapse, lens injury, endophthalmitis, vitreous hemorrhage, and retinal detachment. In spite of advancements in medicine, these result in substantial visual impairment and hence a lifelong sequelae. Hence, in these cases, prevention is much more important than treatment. The aim of my study was to assess visual outcomes in pediatric open globe injury patients. Objectives were to assess improvement in the best corrected visual acuity as well as analyze the causes of these cases. The study was conducted at Mahatma Eye Bank and Eye Hospital. It was a 1-year study with a sample size of 18 and the study type was prospective type. Pediatric patients coming to OPD diagnosed with open globe injury were included in my study. Patients who were not willing to participate and with age greater than 18 years were excluded. After written consent, the demographic profile was recorded, detailed clinical history was taken, mode, cause, type and zone of injury were also included. Detailed ophthalmological evaluation including best corrected visual acuity, anterior segment, posterior segment examination was done. Appropriate management was done. Patients were followed up and outcomes were assessed at 6 months. The sample size was 18 with a significant male predominance accounting to about 16 cases out of 18. The mean age group was 8.8 plus minus 3.64 years. The most common cause that we found out in our study was from wood bamboo stick and pen pencil injury. The most common type of injury was penetrating type followed by rupture followed by intraocular foreign body which was seen in about 2 cases. The most common zone that was involved in our study was zone 1 followed by zone 2 followed by zone 1 and 2. In one case we found out that it involved zone 3. The baseline mean visual acuity in all these cases was 2.15 plus minus 1.47 logmar which improved to 0.23 plus minus 0.18 after treatment. Statistically significant improvement occurred in visual acuity on follow-ups post-surgical management with a p-value of around 0.01. About 60% of the cases required a primary wound closure. In 4 cases we did wound closure along with cataract removal plus IOL implantation. Out of the 2 intraocular foreign body cases, 1 required foreign body removal with anterior vitrectomy, while in the other one it was accompanied with cataract removal plus IOL implantation. The most common type of injury in our case was penetrating type. This was consistent with studies conducted by Aksu, Silan et al. And Lee X et al. Zone 1 injury accounted for majority of the cases, which was similar to the studies conducted by Chen H et al. And Lee X et al. Significant improvement in best corrected visual acuity occurred post-operatively on subsequent follow-ups. All eyes were preserved and showed improvement in visual outcome. Greater improvement in visual acuity occurred in patients with a better baseline visual acuity as well as an earlier presentation. No patient was lost to follow-up at the end of the study. Limitations of my study are a smaller sample size and a shorter follow-up. To conclude, I would like to say that the study showed that pediatric open globe injury was seen majorly in age group between 7 to 11 years with a significant male predominance. It was seen that these injuries result in significant visual loss, but timely and appropriate management resulted in significant improvement in visual acuity in almost all of these cases. Injury by pen, pencil, wood, bamboo sticks accounted for majority of the cases. However, studies with larger sample size and a longer follow-up can definitely help us reach much clearer conclusions. Challenges that we face in these cases are repeated evaluation under anesthesia, multiple surgeries may be needed, care and multiple follow-ups, post-operative amblyopia and glaucoma management. My takeaway message would be timely and appropriate management definitely results in significant improvement in visual outcome in all these cases. Without a doubt, we should all focus more on the children and definitely create a safer atmosphere for them. These are my references. Thank you.
Thank you. So, what was your pediatric population till what age you took as?
Sir, we included up to 18 years.
Up to 18 years. Okay. And how many of them underwent multiple surgeries?
Sir, two of them.
underwent
The
multiple.
intraocular foreign body ones, both of them.
They underwent multiple. And how long is the follow-up?
Sir, I assessed at 6 months, but then
You have longer follow-ups
Yeah,
as
we
well.
do have. But then for standardization, we assessed at 6 months.
Okay, I think thanks.
Thank you.
That's good. Thank you.